Hello, ladies and gentlemen. Welcome to Triple N Media News Flash. We are talking about omega-3 fatty acids and the new American Heart Association recommendations for using omega-3 fatty acids. Before we go into the American Heart Association classification, let us look at what are omega-3 fatty acids, what are the sources of omega-3 fatty acids, and how they can benefit you if you have cardiovascular problems. Omega-3 fatty acids are polyunsaturated fatty acids. They are found in a variety of both animal and vegetable products. The interesting thing about omega-3 fatty acids is they reduce the LDL cholesterol and they reduce the overall cardiovascular risk. Now let's look at some of the naturally occurring products that have high levels of omega-3 fatty acids, so you can know what are the sources of omega-3 fatty acids in your particular case. Then we'll look at the American Heart Association recommendations for 2017. Alaskan wild salmon is supposed to be high in omega-3 fatty acids. Similarly, mackerel is also been found to have high levels of omega-3 fatty acids. Nuts such as pecans, even leafy vegetables, water squash, kidney beans, walnuts, and more importantly, flaxseed. Among the vegetable oils, cold pressed olive oil has been found to have significantly high concentrations of omega-3 fatty acids. Now let's look at the latest 2017 American Heart Association recommendations for using omega-3 fatty acids. The American Heart Association recommends treatment with omega-3 fatty acids, that is polyunsaturated fatty acid supplements, is reasonable for secondary prevention of coronary heart disease in patients with recent cardiovascular events such as myocardial infarction. That is to say, if you have a history of coronary artery disease documented with a history of heart attack or by cardiac catheterization, you have blockages in your arteries, then it is reasonable to use omega-3 fatty acid supplements to reduce your risk further by lowering the cholesterol level, particularly the LDL cholesterol. Treatment with omega-3 polyunsaturated fatty acid supplements is reasonable for patients with history of existing heart failure with low left ventricular systolic function to reduce mortality and hospitalization. However, treatment with omega-3 fatty acid supplement is not recommended to prevent stroke in patients with high cardiovascular risk factors or patients with history of recurrent atrial fibrillation. That means if you have a cardiovascular patient who has heart disease or heart failure, or a patient who has atrial fibrillation, giving omega-3 supplements does not reduce the risk of stroke. So it is not recommended for that particular purpose, even though you can use them to reduce the cardiac risk itself. Here's another recommendation, that is consensus on the recommendation for patients with high cardiovascular risk. The available evidence does not support the use of omega-3 polyunsaturated fatty acid supplements in general population without any history of cardiovascular disease, including those with diabetes mellitus or pre-diabetes. This is an interesting recommendation. What they are saying is that if you do not have high risk factors for coronary artery disease, and even if you have diabetes or pre-diabetes, omega-3 fatty acids are not recommended to reduce the cardiovascular risks. Well, that's the American Heart Association recommendation for 2017 as far as omega-3 fatty acids are concerned. I am Dr. Nik Nikam, and please do subscribe to our YouTube channel, and we will see you next time. Thank you so much.